Chairman, and let me thank each one of you for your very impactful testimonies. As a matter of fact, you reinforced for me, having taken a job in 1970, working with the Visiting Nurses Association at a community health center in Chicago, where I first learned some of the principles and practices of what home visiting really is about. Dr. Sinez, you were instrumental in bringing home visiting to the Navajo Nation and adopting the parents and teachers model to incorporate it into the Navajo culture. Could you tell us more about some of the gaps that home visiting filled for this population group?
Thank you for that question. As I mentioned earlier, we do provide the direct visits to the families, so that definitely fills the gap of families not having to come to us for services. The incorporating the Navajo culture and language into our program also builds that child-family relationship. We've adapted the parents as teachers model to incorporate Navajo culture and values, which is allowed in the parents as teachers model. So that fills that gap of developing a curriculum and services directly for the family's needs. We work with families to connect them to resources such as food insecurity resources and other resources for developmental screenings. We connect them to early intervention. Children are often identified through our early intervention program and referred for home visiting to provide the direct services for the families.
Thank you very much. Ms. Smith, I was very interested in the comments that you made relative to work with males in the program. Could you share with us a bit about that work?
Of course. What we try to do is we're engaging fathers from every stage of home visiting. If it's during recruitment, during enrollment, and throughout the service with a home visitor, we're engaging them to be invited in the service, in the home visiting. Actually, their sessions, as well as having parent support groups just for dads. What we have found is, I talked to a father a couple weeks ago that was going through a graduation ceremony, and he stated that this was the first program that first invited him to participate, engaged him to participate, had resources that were geared more towards dads, and also provided a peer support group of dads that are able to talk like dads. He said, I finally was respected as a father. Someone actually listened. And so, being in human service a long time, we know that not everything has been set up to do that. So I think partnering with fathers, hearing how they like to be engaged, how they like to show up is really important. In Brightpoint, we spend a lot of time talking to dads to get that input. So it's a partnership, and the children have loved it. We have found in our doula program, if we get fathers involved in the prenatal program, they're more likely to stay throughout the time of the program. And what research shows that if a father's involved in the prenatal time, they're more likely to stay in the child's life long term, whether or not the parents stay together. So it's really important. Mm-hmm.
And Ms. Wilson, I'm very familiar with the type of communities that you described in your testimony. I've lived in those kind of communities. I've been a part of those kind of communities. How helpful was the inspiration that you received from your caseworker or your worker?
Thank you for that question. She was very helpful. I mean, even going back to what you were talking about involving fathers. My fiance, he's now my fiance, but at the time he was my boyfriend, and we had our child together. And one of the things that she would do is definitely involve him in the parenting process of it. And it wasn't hard because he's always been very very much involved in it. But even just teaching him some of the tools and making sure that he's a part of the conversations that we were having. When I had questions about sleepovers or, letting him go over people's houses and, how to how to create those boundaries with where he can go and where he cannot. She was very helpful in helping me realize that I'm allowed to have those boundaries and how to safely establish those, and that I didn't have to be mean about it, but just keeping him close. And it made me feel really good and confident about raising him, knowing that I had that option to say, I don't feel safe with my son here. He has to stay there. When I was showing her the places that I wanted to move to, we came up with a gated community, so I was really excited about that. She provided safety just when she came and visited the home, making sure that she didn't make us feel unsafe. I know for me, I was always scrabbling around and trying to clean up before she got there, but she just stepped in and she's like, it's fine, it's fine. So it's that confidence that allows you to feel okay in your house. It's hard to open those doors to people and feel like you might be judged. So
Thank you, Thank you very much, and I yield back, Mr. Chairman.